introduction to community health advocates. Today, we're going to discuss who we are. We'll go over who Community Service Society is, or department here at Community Service Society known as Health Initiatives. We'll go over the different programs within Health Initiatives. We will also discuss what we do. Again, we will discuss the roles of Community Service Society, our volunteers, our specialists, and our advocates. But first, this is an overview of Community Service Society and Community Health Advocates program model. As some of you may know, Community Service Society is a very old nonprofit organization that has been a leading voice on behalf of the poor and low-income New Yorkers. We do different activities and initiatives to be able to respond to the needs of struggling families, not only in New York City, but also across New York State. We keep a pulse and report on injustices that hinder participation in employment and really that hinder economic mobility. And we represent millions of individuals trying to overcome the effects of poverty. We work with other partners to promote progressive ideas, again, across New York City and the state. And we do all of this through research, advocacy, litigation when necessary, and innovative program models that strengthen and benefit all New Yorkers. And you will see today some of those program models that we have been able to successfully implement at local and New York State levels. So what is community health advocates? So as I said before, the goal of Community Service Society as an agency is to be able to improve the lives of low and moderate income New Yorkers. And so one of the big decisions that Community Service Society has had in recent times is to strengthen its focus on healthcare and healthcare access. And as a result, CSS developed this three-legged stool model where we provide direct healthcare access services through our various programs. We do policy analysis from the consumer's lens, which means that from the work that we are doing and from the services that we're providing directly to consumers, we are able to identify issues that may be systemic and then be able to do the last point, which is advocate, organize, and respond to those issues in order to create systemic change. So we're not only addressing the individual case issues, but whenever we encounter a systemic issue, we're using our additional tools from a policy and advocacy perspective and working with various partners and stakeholders to be able to, again, provide systemic change. Within Community Service Society, we have a department known as Health Initiatives. And within Health Initiatives, there are various programs that provide services throughout New York State. And there are 3 programs that we will go over in more detail. We have the CSS Navigator Network, we have the Independent Community Advocacy Network known as ICANN, and we have Community Health Advocates. So Community Health Advocates is the main focus of this presentation, but for purposes of this training, you will also get a quick overview of the other networks that we have at CSS. And in addition to that, you will also get a preview of other smaller programs and initiatives that we do at Health Initiatives within CSS. So what is Community Health Advocates? When you think about CHA, which is what we refer it as, is think about any issue related to health insurance and the fact that we are able to help consumers address those issues. So in a nutshell, we provide free one-on-one unbiased information and help related to health coverage. So this not only involves like enrolling and helping individuals enroll in coverage, but also once they are enrolled, helping them access care. We are the only entity that offers assistance regardless of income or source of coverage. What this really means is that whenever you get a consumer that has an issue related to health insurance or healthcare access, we are not asking them what type of insurance they have for purposes of determining whether we can help them or not. And we are not asking them for their income to determine whether we can help them. We can help anyone regardless of income, and we can help anyone whether they have commercial insurance, which includes employer insurance, or whether they have public insurance, such as Medicaid or the Essential Plan. On the right, you're going to see a nice little pie chart that gives you an idea of the type of insurance consumers have when they get our services. So a high number of them you will see have either Medicare or Medicaid. Then the biggest other proportion is commercial insurance. And as I said, when I say commercial insurance, it includes employer insurance or insurance that individual gets directly from a health plan. And then we obviously serve a good percentage of individuals that simply do not have insurance. And you will see the other breakdown for the other public health insurance programs. So one of the other things that CHA does is provide culturally and linguistically competent services in more than 23 languages. And we are able to do that because we have community-based organizations and small business serving groups located throughout New York State that are really responding to the local needs of their community. And each of those agencies typically has staff that is able to provide services in more than one language. And those services, in addition to being in the consumer's language, are also provided in a culturally appropriate manner, in part because the community-based organizations doing the work are reflective most of the time of the community that they are serving. So we really pride ourselves in being able to do that through this program. And as I've said before, three of our main core programs, we offer services in every state, or at least for community health advocates, we do offer CHA post-enrollment assistance in every county throughout New York State. And again, we do this through what we call our hub and spokes model, which I'll talk a little bit more in this slide. So this is how we work, and this is our model. You will see on the left-hand corner, we have Community Service Society, and we here provide assistance through our helpline. We handle complex cases. We create a learning community for community-based organizations. We administer grants that we provide to our community-based organizations to do CHA work. We monitor the performance and quality of the services we are providing through quality assurance protocols. And we're also responsible here at CSS to obviously report to our funders. For community health advocates, the main funding comes from the state. So every quarter we submit a quarterly report to the state letting them know of our work. And then we are here at CSS also conduct what we call the sentinel function, which is being able to gather information about systemic issues and being able to address them. And then we have what we call our spokes, and those are community-based organizations that receive funding from us, and their main role is to conduct outreach, community presentations, and do post-enrollment assistance casework. And we're very lucky that for community health advocates, we also have specialists. And these specialists provide technical assistance to our CBOs and to Community Service Society as well. And they provide trainings and also do casework. Our three specialists are the Medicare Rights Center, the Legal Aid Society, and Empire Justice Center. So again, Community Service Society acts as the central hub. Our spokes are the community-based organizations that we have out there in the community, along with the assistance of our specialists that are critical in the work that we do. Well, how do consumers find community health advocates? They come primarily from referrals from other navigators or community-based organizations. We also get a good number of consumers coming back from referrals from family and friends. One critical source comes from insurance notices. So there is this explanation of benefits, and every explanation of benefits a consumer gets has our phone number, and that phone number leads to our main helpline. Referrals to CHA also come from providers, so particularly providers who have been satisfied with the work we've done in the past will likely refer consumers to us to help them access the services that they need. How do we help consumers? Well, there's different ways how CHA helps consumers. We help consumers enroll in non-marketplace coverage. What I mean with non-marketplace coverage, this is coverage through the local districts. The reason why we do not do or count enrollments through the marketplace as part of CHA is in part because we have a completely separate program, and that is our Navigator program. And that program is focused on providing enrollment assistance through the marketplace. So for purposes of CHA, we help consumers enroll, but not through the marketplace, through the local districts. And usually those individuals involve people who are over 65, who are blind or disabled. Those are called or non-MAGI populations, which you would learn more if you haven't already about that process and the non-MAGI eligibility. We also help consumers understand how to use and maximize their coverage. So the things don't end after you enroll in coverage. You have to really understand how your insurance works, and that is a key function. Pretty much every consumer that reaches one of our CHA advocates, it's learning basics, it's learning information that it's going to help them improve their access to care. We also remove barriers to access to medical services. We resolve medical billing issues. So a lot of our consumers are going to reach out to you and say, I got a medical bill, how do I resolve it? We also help find lower prescription drug costs. So there may be individuals who are enrolled in Medicare and they've reached their prescription coverage limit and often referred to as a donut hole, so we would be helping them find alternatives. Or we have an individual who may simply not have insurance and they need to access a critical prescription, and we would be helping them as well. We also help finding expensive care if they are uninsured or if they're underinsured. Oftentimes we have consumers who have insurance, but they may still be subject to high deductibles or co-payments. So we would be helping them figure out what are their medical needs and how can they best access them. And we report back to policymakers on issues that we encounter at the local level. Here's our helpline. Our main helpline, again, is located at Community Service Society within our Health Initiatives Department. On average, we answer over 10,000 calls every year. Most of the cases that helpline handles are commercially insured cases. We are open Monday through Friday from 9 to 4 p.m. and it is staffed by CSS and trained volunteers. And I have to say that we're very fortunate. We have a really good pool of volunteers that we recruit every year, some who have been with us for years, and they're very knowledgeable, and we always appreciate their expertise and dedication to our program. And so they are the frontline staff here at CSS who are able to take those calls and get an initial intake and an assessment of the clients. I do also have to say that a lot of the cases that come through our helpline are actually handled and closed by our helpline. Complex cases that are not handled by our helpline are handled by our case handlers or attorneys, particularly if the case involves appealing a denial. Common CHA questions we get: I just received a bill from the hospital that I cannot pay. What should I do? The prescription drugs that I need are no longer covered under my Medicare Part D plan. What should I do? How do I get them covered? My insurance company is denying my claim, stating that the services I got were not medically necessary. I received a notice that my Medicaid benefits are going to be discontinued. What can I do? So those are like common questions and a sample of questions that we may be getting through our helpline. Again, for our helpline volunteers and staff, they are fully trained, and most of these questions are, they are able to answer them and address similar issues on the spot, and at times it may require a second conversation with the client or follow-up to make sure that everything was settled. So now moving on into our Navigator network, it's called the Community Service Society Navigator Network. And again, as I mentioned, their main focus is on helping individuals enroll through the New York State Health Marketplace because they are funded by the state and not any other source. They are able to provide impartial enrollment assistance. They provide enrollment assistance throughout New York State, and they can help individuals and small businesses explore their options. And in the role of small or individuals, I should say, they can help them navigate the entire enrollment process into either public health insurance or qualified health plans, which are kind of like the commercial plans. And they may also be able to assist consumers in other ways and provide referrals to other programs. And this is just kind of, again, a reiteration of what navigators do. Common navigator questions: how much financial assistance am I eligible for the marketplace? I am losing my insurance through my job. What are my options? I don't have health insurance. Do I have to pay the tax penalty? Or I just moved from another state. Can I purchase health insurance here in New York State? So all of those questions our navigators are able to answer. We have this other program that it's seasonal, and it's a combination of like post-enrollment and enrollment, and it is primarily handled through our helpline, and it is called the Health Insurance Tax Credit Assistance Project. And basically, individuals who need to file their taxes and show that they had insurance throughout the year, the previous year, they may sometimes have questions about the tax forms, or they need help getting the tax forms. So we are able to respond to their questions and help them navigate any additional systems they need in order to get the information that they need for purposes of complying with the individual share of responsibility, which is known as the tax penalty for not having insurance. So there are different forms related to this process, and again, our volunteers are fully trained in order to be able to answer consumer questions. And this program, again, is seasonal, so we start in like late January, early February, and we start getting an influx of calls, and we go throughout the tax season. These are common HCCAP questions that we get. Do I qualify for the short-term coverage exception, which means, for example, I didn't have insurance for 2 months. Would I be exempt from the penalty? How can I access my 1095A or 1095B, which are the tax forms related to whether someone had insurance and the month that they had coverage? I don't have health insurance. Do I have to pay the tax penalty? Do I have to file taxes if I received APTCs, which are known as advanced premium tax credits? So what is ICANN? ICANN is a program that helps individuals solve problems with Medicaid long-term care and managed care. So from the get-go, these are individuals that are needing long-term care services and have Medicaid and Medicare in most instances. This is kind of like the dedicated program for this population. It is a trustworthy source, and they have a lot of expertise, and they help individuals receive care in their own homes or communities if necessary. Common ICANN questions: my mom needs home care. How do I get her access to the service? My home care hours were reduced. What do I do? What is managed long-term care? Can I enroll in FIDA? So our advocates will learn more about managed long-term care, but when in doubt, whether you're an advocate or a volunteer, you want to make sure that you touch base with a supervisor in case you're not clear on the referral process to ICANN for individuals, again, who are needing long-term care services. The East Harlem Health Project is, again, another project within our department that is like smaller in scope. And this project helps New York City housing residents, NYCHA residents in East and Central Harlem, enroll in health insurance and also address post-enrollment issues and make sure that they're accessing healthcare. The primary focus is on specific NYCHA housing communities, and it's Johnson, Clinton, King, Lehman, and again, our advocates there are focusing on individuals who have chronic conditions and are really trying to make sure that, one, those individuals have ongoing health insurance, and two, that they in fact are able to access that care and educate themselves on accessing those services in a more preventative measure, as opposed to, relying on a medical emergency and then having more long-term negative consequences. So this project is funded by the New York City Department of Health and Mental Hygiene. Then we have our policy leg, which is Healthcare for All New York, and CSS, or Health Initiatives Department, is very involved in that from a policy perspective. And Healthcare for All New York is a coalition of over 160 groups that are dedicated to expanding healthcare coverage in New York. And they've also been critical in defending the Affordable Care Act in recent times. They have different committees that focus on different areas. There are 5 task force focused on racial and ethnic disparity, children, youth and families, LGBT, dual eligibles. Dual eligibles, again, are those individuals that have both Medicare and Medicaid, and obviously there's a focus on public programs. Now, our helpline volunteers. As I mentioned before, our helpline volunteers are all here on a voluntary basis, as it is inferred, and they get training, initial training, and then ongoing training to make sure that they are equipped with the tools, knowledge, and resources to provide assistance over the phone. They are able to provide general case advice. They help us at CSS help identify trends and issues, in part because they are the ones receiving a lot of calls. So if a consumer calls with an issue with a particular plan, and then another consumer calls with the same plan issue, then they are able to alert us, and we can follow up on those cases. And the other big function is, once our volunteers do an initial intake, they also help us follow up on some cases. And so they are very instrumental to the work that we do. Our specialists, as I mentioned, we have 3 specialists within Community Health Advocates, or for Community Health Advocates. That's the Legal Aid Society, Medicare Rights Center, and the Empire Justice Center. They provide trainings for both our volunteers and our community-based organizations, and they also provide technical assistance. Another key role of our specialists is that they are able to take referrals of complex cases, which is great. So there may be some cases that require more expertise, and they are able to give us that assistance. There are protocols of how do we refer cases or get technical assistance from our specialists, and we can share those protocols. If you are a volunteer versus an advocate, I would always encourage you to talk to the helpline supervisor to make sure that the referral is appropriate. And usually it will be a CSS staff or a helpline supervisor who will be getting technical assistance, and not necessarily the volunteer themselves. And that's just for us to be able to continue tracking what has happened on the case. Our specialists also help identify and advocate for systemic change by addressing those systemic problems. Here's some general guidelines. If individuals or advocates are upstate or on Long Island, we use the Medicare Rights Center for Medicare-related questions, and Empire Justice Center for all other CHA cases that are not Medicare. For downstate folks, we use, again, the Medicare Rights Center for Medicare-related questions, and the Legal Aid Society for all other cases. And here at CSS, we provide technical assistance to everyone, whether you are downstate or upstate, and it could be related to Medicare or not. So feel free to reach out. Here are our advocates. These are our advocates that come from our different community-based organizations. Every year we have an annual training, and we take this beautiful picture showcasing them, and they're a great asset for obvious reasons to the work that we do. We also serve small businesses, and I don't want to forget that we do serve small businesses. And our small business work is done primarily by a few agencies A couple of them focus only on small business work, and they're really providing education on health insurance options for small businesses, benefits of offering insurance to individuals who are employees in those small businesses, and obviously if a post-enrollment issue arises, they are helping as well. Here's our map for community health advocates. The map does get updated. We rarely, but sometimes do add new CBOs, or a CBO might leave the network. Again, this does not happen often, but from time to time it does. This is our navigator map, and this is to make referrals to navigators for individuals that may need enrollment assistance in the marketplace. This is our ICANN map. Again, you would be using this map to refer individuals who need long-term care services. This is our FEABD facilitated program, and this program provides enrollment assistance to individuals who are age, blind, and disabled. And one of the reasons we didn't provide more information about this program is, in part, CHA is able to help individuals, or advocates are able to help individuals enrolled in non-marketplace coverage. And two, unlike our other networks, our FEABD network is a little bit smaller. They still cover a lot of counties, but it's a little bit smaller. You can feel free, if you're an advocate or if you are working on the helpline and need to refer someone in one of these counties, to use this map for referral purposes. If at any point you have questions after reviewing this presentation, you can reach out to us. If you're a volunteer, you can always reach out to your helpline supervisor or to any of CSS staff to follow up on those questions. And this concludes our introduction to community health advocates.